Are we buying the right foods to keep our heart healthy? Earlier, I posed some common food items to Dr. Tim Malins of Rochester General Hospital to get his opinion about whether he'd recommend them to his patients. And you might be a little surprised. Here's this week's Your Heart and You. Tonight, we're going to ask Dr. Tim Malins about foods that boost heart health and foods that do not boost heart health. But I thought I would do this by letting you know via a confession about what was in my grocery cart just a couple of weeks ago. I remember thinking, I don't know if this is so good. I'm going to name a couple of the items. You let me know whether I was on track or way off base, okay? This is foods that boost or do not boost heart health. How about it?
I like it.
First thing, canned frosting.
Terrible, terrible, and then terrible.
Oops, okay.
So fattening and really high carbs.
Really high carbs, so not good for the heart. Okay, bagels.
Bagels, not bad. Bagels are whole wheat grain, which are not too bad. Some of them have some increased fat. It's a fairly decent carbohydrate load, but you didn't do too bad with the bagels.
All right, Diet Coke, soda.
I don't have a huge problem with Diet soda per se for the heart standpoint. Low carbohydrate, no fat, no cholesterol, so I'll give that an okay.
Okay, but moderation, right?
In moderation.
Sugary cereal, I have to admit that I love Honey Nuts and Oats.
Well, you're getting your whole grains, so that's good. So you're getting your fiber, and fiber helps take cholesterol out. I'd switch it to just strict Cheerios, but that's not too bad.
Okay. Stick margarine?
Stick margarine. If I was going to go the margarine route, I would probably do the either ones that are fortified with olive oil or the Benacar type, which actually have been shown to decrease cholesterol and maybe give a little boost to the good, decrease the bad and give a boost to the good.
Love bacon. I love BLTs. Bacon.
You know my answer to this. Bacon is terrible. Now, in moderation, I always say anything.
Yeah.
Bacon is fine if you have it once a year. Okay. Now, high salt load, high fat, not good. I can give you one example, which I have a guy who I see as a patient, and he had coronary disease, and he works very, very hard on diet and exercise all year long, and every year, and he comes back to see his number, and his LDL goal has to be 70 or below. And if he reaches that goal, he leaves my office and goes and gets a Nick Tahoe's garbage plate.
Yeah, well, he's earned it after a year.
Every year, and if he doesn't make it, he doesn't get it. But anything in moderation.
And finally, soy sauce.
Soy sauce, not terrible, high salt load.
Yeah, these are all items I've wondered about. If you could name 5 foods that you encourage your patients to eat, what are they? So,
number one, I would probably say fish, or salmon is probably the best. I like salmon because it's very good in the omega-3 fatty acids. The type of fat that it has is this unsaturated fat, shown to lower cholesterol. So salmon, I think, is a great one. 2 is whole grains, and one of the whole grains that I've gotten into more recently is something called quinoa, which is a South American whole grain, high in protein, low in calories, and a lot of fiber to help kind of get that bad cholesterol out. I'd probably throw fruits and dark berries, cherries, blackberries, avocados are, I think, a great way to get your fat, the good fat, which lowers the bad cholesterol. And then to finish it out, why don't we add, I don't know. You gave me 5, I'll give you 4.
That's good. Listen, those are great because I like all of them, so I'm in luck.
Tofu, there's my 5.
Tofu, okay.
Good protein.
Dr. Tim Malins, thanks for all the advice.
All right, my pleasure.
For more Your Heart and You segments, just head to our website, rochesterhomepage.net, and click on the News tab. And yeah, I threw out the canned frosting.